So good evening everybody, and today I'm going to take a brief session on the important previous year questions which have been asked for the autonomic nervous system, ANS. There are a few questions which have been asked previously. So I'm going to take those MCQs and we are going to discuss around them. So these are very important topics for you to know. So I am going to put forward the questions as always and try to participate in answering the questions. You know or you do not know, doesn't matter, but just take part because this is the time where you can make mistakes and learn from them. Okay? So let's get started. There are a few questions and please note that whatever the question is, that is important definitely. But because they've been asked time and again in the previous exams, so try to study that particular topic in detail. Next time, usi topic ke around anything else can be asked. So that means that topic is important. We don't only study MCQs, just study the MCQs and memorize it. No. Whenever MCQ is asked on a particular topic, it means that topic is important. And this time, this particular thing has been asked from that particular topic, and next time something else can be asked. So that topic as a whole you need to know. So that's what we mean when we tell you to practice the previous year questions. So not just the MCQ, but that topic जितने भी उस MCQs में आए हैं, वो topic सारे के सारे they are very important. I hope you understand the meaning of revision of previous year questions. So any of you who are having their competitive exams in the near future, so these questions have been asked, so they are really, really important for you to know. So remember, I hope that you've covered this. You will know that yes, I've covered this topic, and so you can put a tick mark against it, right? All right, let's go to the first question. Pinpoint pupils. So the question is, pinpoint pupils can be seen. Pinpoint pupils can be seen in the poisoning due to. First option is DDT. Second option is opiates. Third option is belladonna. And fourth option is barbiturates. So pinpoint pupils can be seen in the poisoning due to. Yes, you can type in your answers. Pinpoint pupils can be seen in the poisoning due to. First option is DDT. Okay, sensitive soul says belladonna. All right. Any other option? Umar Farooq also says belladonna. Okay. Any other answer? Yes, you can answer. जो भी आता है, whatever you know, you can answer. C. Surya says C. C is belladonna. Okay, again. So pinpoint pupil. Okay. Varshane Siddharth says opiate. All right. So the correct answer is yes. Varshane Siddharth is correct. It is opiate. Belladonna में क्या होता है? What is the active ingredient in belladonna? Yes, what is the active ingredient in belladonna? जब हम belladonna poisoning की बात करते हैं या belladonna plant की बात करते हैं, what does belladonna contain? Yes, what does belladonna contain? Very, very important topic. Belladonna poisoning, belladonna, very important, very important. So belladonna contains, और the plant है Atropa belladonna. इसमें होता है atropine. So atropine is a anticholinergic agent, right? So anticholinergic agents जो होते हैं, they do not cause meiosis. Yes, very good. Atropine causes mydriasis. Remember in the previous time, if you remember the atropine की history हम जब करते हैं, so it was used in the previous years by women on those queens. And they used to put drops of Atropa belladonna in the eye to enhance the beauty of the eye. Why? Because it used to dilate their pupils. Mydriasis cause karta tha. So Atropa belladonna, atropine, remember anticholinergic drugs, they cause mydriasis. So Atropa is not the correct answer here. So another important thing to remember. So atropine, mydriasis. Cholinergic drugs like pilocarpine and all, they cause meiosis. अब आती है pinpoint pupils की. So pinpoint pupils are classically seen with, if you remember, the 3 P's. First P is your organo का ऑर्गेनोफॉस्फेट, ऑर्गेनोफॉस्फेट पॉइजनिंग में. सो ऑर्गेनोफॉस्फेट पॉइजनिंग या कार्बामेट पॉइजनिंग जिसको भी हम कह सकते हैं, दे कॉज पिन पॉइंट प्यूपल्स. ठीक है. So the second one is P is your painkiller like morphine. Morphine belongs to opioids. They cause pinpoint pupil. The third differential diagnosis of pinpoint pupil is a pontine hemorrhage. ये तीनों की तीनों चीजें pinpoint pupils cause करती हैं. Now the question is, let's say the patient has come with pinpoint pupils. Pontine hemorrhage ruled out. Let's say, okay, that is ruled out. But how will you differentiate whether it's an organophosphate poisoning or it's a morphine? Let's say कोई history नहीं है, कोई साथ में family member has not told us कि what is the cause. So how would you differentiate whether it's a organophosphate pinpoint pupil due to organophosphate or pinpoint pupil due to morphine? So what will you look for there apart from the pupil? Apart from the pupil, what we look at is, we look at the secretions. ठीक है, secretions देखेंगे. Secretions will be enhanced in case of cholinergic excess, that is organophosphate poisoning. But it won't be the same when it is morphine poisoning. So this is how you will differentiate between the two. So pinpoint pupils, very important to remember which drugs cause it. Atropine का effect on the eye and belladonna poisoning, very important to know. ठीक है. देन मॉर्फिन कॉजेज पिन पॉइंट प्यूपल, वेरी इंपॉर्टेंट टू नो. सो ये सारी चीजें इसमें बहुत इंपॉर्टेंट है. सो इस एमसीक्यू से आपको क्या पता लगता है कि आपको क्या टॉपिक अच्छे से तैयार करना है. दैट इज बेलेडोना पॉइजनिंग, पिन पॉइंट प्यूपल्स, ऑर्गेनोफॉस्फेट पॉइजनिंग, मॉर्फिन. तो इसके बारे में कुछ भी पूछा जा सकता है. इट्स वेरी वेरी इंपॉर्टेंट. ठीक है. सो अनदर क्वेश्चन अगर इसमें से पूछूं मैं, व्हाट इज द ड्रग ऑफ चॉइस फॉर मॉर्फिन पॉइजनिंग. ठीक है. अभी हमने कहा पिन पॉइंट प्यूपल इज बिकॉज ऑफ मॉर्फिन ओवरडोज. सो व्हाट इज द ड्रग ऑफ चॉइस फॉर मॉर्फिन पॉइजनिंग और मॉर्फिन ओवरडोज? एनीबडी? एनीबडी? ड्रग ऑफ चॉइस फॉर मॉर्फिन ओवरडोज और मॉर्फिन पॉइजनिंग? नो ड्रग ऑफ चॉइस फॉर मॉर्फिन पॉइजनिंग? यस. It is naloxone. Naloxone for morphine poisoning. Naltrexone, naloxone. Yes. And what about organophosphate poisoning? Drug of choice for organophosphate poisoning. Very important again. Drug of choice for organophosphate poisoning. Drug of choice for organophosphate poisoning. सारे एंटीडोट्स, सारे जो पॉइजनिंग के एंटीडोट्स, अगेन extremely important for your examination point of view. Extremely important. This time they had about 2-3 questions for this. Atropine, very good. Atropine, Dolly Singh, excellent. Atropine is the drug of choice for organophosphate poisoning. So remember all these things. So इसमें दो drug of choice हो गए, morphine and organophosphate poisoning. Oximes are not the drug of choice. अगर हम ड्रग ऑफ चॉइस, ऑक्साइम्स आर सेड टू बी एक्चुअली दे हैव एन एडजंक्टिव एक्शन. पहले सबसे पहले एट्रोपिन देना है, उसके बाद ऑक्साइम्स देना है. ठीक है. सो दैट इज द फर्स्ट थिंग दैट यू डू. ऑलराइट, लेट्स कम टू द सेकंड क्वेश्चन. नाउ विच ऑफ द फॉलोइंग, अनदर वेरी इंपॉर्टेंट टॉपिक इज ग्लोकोमा. विच ऑफ द फॉलोइंग एंटी ग्लोकोमा ड्रग, विच ऑफ द फॉलोइंग एंटी ग्लोकोमा ड्रग कॉजेज हेटेरोक्रोमा आयराइडिस? Which of the following anti-glaucoma drug causes heterochroma iridis? और इसका दूसरा नाम है pigmentation of iris, you can say. Timolol, latanoprost, aproclonidine, acetazolamide. ठीक है. Timolol, latanoprost, aproclonidine या acetazolamide. Prostaglandins, so you mean latanoprost. Okay, Neeraj says prostaglandins. Umar Farooq says atropine. Beta, so you must be answering for the previous question. That is for the choice. Latanoprost. Yes, latanoprost. So pigmentation of iris is caused by latanoprost. Excellent, Neeraj. Yes. So please remember this side effect has been asked time and again, sometimes in the form of a picture, where they show you the pigmentation of the iris, or sometimes just like this statement, which of the following drugs cause heterochroma iridis, which is the pigmentation of iris. It is caused by latanoprost. So remember the important another very high yield topic is your anti-glaucoma drugs. Many a times at least 1 or 2 questions have been asked from this particular topic itself. So especially अगर आप बात करेंगे latanoprost की, ठीक है? So latanoprost causes the pigmentation of iris. That is important. It causes the eyelash growth, excessive eyelash growth जो होती है, ठीक है? That is caused by this. Then macular edema is caused by, okay, I will repeat the question. Which of the following anti-glaucoma drugs causes heterochroma iridis? Or it can be, which of the following anti-glaucoma drugs can cause pigmentation of iris? So the correct answer is the latanoprost out of these options, right? So latanoprost causes pigmentation of iris. Another important side effect which is often asked is that the growth of the eyelashes, right? So eyelash growth is caused by latanoprost. Macular edema is caused by this. That is the important side effects to be remembered with latanoprost. Then can you tell me about the apraclonidine? Side effects of apraclonidine. Side effects of apraclonidine. कोई बता सकता है? एंटी ग्लोकोमा ड्रग जब एप्राक्लोनिडीन करते हैं, व्हाट इज द साइड इफेक्ट ऑफ एप्राक्लोनिडीन? वेरी इंपॉर्टेंट साइड इफेक्ट. It is lid retraction. Lid retraction is one of the important side effect of apraclonidine, and also it is not given in children less than 2 years of age. It is not given in children less than 2 years of age. Why? Because it can cause apnea, ठीक है, in them. So it is not given in children less than 2 years of age, and important है lid retraction. Then another side effect to remember is for acetazolamide. Acetazolamide क्या cause करता है? Corneal edema. Corneal edema, ठीक है? Ocular allergies, corneal edema is caused by acetazolamide. Please remember all these side effects. They have been asked, right? Acetazolamide, corneal edema, ocular allergy. Dipivefrin can cause conjunctival hyperemia. Conjunctival hyperemia. So ये सारे side effects जो हैं, you should know. Anti-glaucoma drugs are very important. Their side effects are very important, and what they do, they are very important. So ये वाला एक क्वेश्चन बहुत बार 2-3 बार ये क्वेश्चन आया हुआ है. Either hyperpigmentation of the iris दिखाई गई है, or they have told you, shown you the picture of the pigmented iris and shown which of the following drugs can cause this. Right? All right. Next, now another question which had come last time in the INICT. Sweating as a result of exertion. Sweating as a result of exertion is mediated by. Sweating as a result of exertion is mediated by. The options are: number 1, adrenal hormones. Number 2, sympathetic adrenergic. Number 3, parasympathetic cholinergic. And number 4, sympathetic cholinergic. Sweating as a result of exertion is mediated by: number 1, adrenal hormones. Number 2, sympathetic adrenergic. Number 3, parasympathetic cholinergic. Or number 4, sympathetic cholinergic. Which of the following, which is the basically innervation की बात कर रहा है? What is the innervation? Sympathetic adrenergic. Okay, Neeraj says sympathetic adrenergic. Yes, any other? Sympathetic, Dolly Singh says sympathetic adrenergic. Uma Farooq says sympathetic cholinergic. Okay. Or Varshne Siddharth says sympathetic cholinergic. Okay. So the correct Umar and Varshine Siddharth, they are absolutely correct. It is sympathetic cholinergic. So remember, ये exception है to the rule. So always remember the exceptions to the rule. Sweat glands में it is definitely from the sympathetic system, ठीक है? बट जो इसका पोस्ट गैंग्लियोनिक न्यूरॉन है इट रिलीजेस एसिटाइलकोलिन ओनली. सो दिस इज एन एक्सेप्शन. इट इज सिंपैथेटिक बट दी अल्टीमेटली जो इसमें पोस्ट सिनेप्टिक न्यूरॉन पे पोस्ट गैंग्लियोनिक न्यूरॉन में जो न्यूरोट्रांसमीटर रिलीज होता है, यस, it is cholinergic, acetylcholine acting on the M3 receptors. So remember this exception. ठीक है, sweating is दो sympathetic शुरू होता है but ultimately जो end है that is your cholinergic. So this is another exception to the rule which you should always remember. All right. Now another antidote, another which is important here is antidote for nicotine poisoning is. Antidote for nicotine poisoning is option number 1 neostigmine, option number 2 atropine sulfate, option number 3 phentolamine, option number 4 trimethophan. Antidote for nicotine poisoning is neostigmine, atropine, phentolamine, trimethophan. क्या होएगा? A, you mean neostigmine, okay? Okay, neostigmine, all right. Any other? Alhamdulillah says neostigmine. Umar says atropine sulfate. Okay. Dolly Singh says neostigmine. Nicotine का antidote है. Surya says phentolamine. So correct option किसी ने नहीं बोला, बाकी सारे options हो गए. So correct option इसमें है trimethophan. Trimethophan. क्यों? Because जो निकोटीन है, अब आप हमने बात, एट्रोपिन एक्चुअली इज अ मस्करीनिक ब्लॉकर. ठीक है, एट्रोपिन इज, वी टेल इट इज अ कॉम्पिटिटिव मस्करीनिक ब्लॉकर. यहां पे मैं निकोटीन की बात कर रही हूं. ठीक है, सो एट्रोपिन नहीं होएगा. बेसिकली जो निकोटीन को ब्लॉक करते हैं स्पेशली वो होते हैं गैंग्लियोनिक ब्लॉकर्स. ठीक है, सो निकोटीन के लिए गैंग्लियोनिक ब्लॉकर्स आते हैं और जितने भी गैंग्लियोनिक ब्लॉकर्स हैं आउट ऑफ द 4 ऑप्शंस इट इज योर ट्राइमेथोफैन. सी ऑप्शन था फेंटोलामीन. फेंटोलामीन इज एन अल्फा ब्लॉकर. इट इज नॉट फॉर दिस, राइट? फेंटोलामीन इज एन अल्फा ब्लॉकर. नियोस्टिग्मीन is an it inhibits the enzyme acetylcholine esterase, so it is an acetylcholine esterase inhibitor. But हम बात करें निकोटीन के रिवर्स के लिए, उसके लिए we use ganglionic blocker. ठीक है, so we have drugs like trimethophan होता है, hexamethonium, mecamylamine. So ये सारी drugs हैं which are your ganglionic blockers. So अगर ऐसा question आएगा so you have to mark trimethophan, which is also used in hypertensive emergencies में use. All right. Now, listen to this one also again. This is another very important topic, which is your dopamine. Dopamine को जरूर पढ़ के जाना है for your exams. काफी बार question आते हैं on dopamine. Now, dopamine, which is given in acute CHF or congestive heart failure, does not act on which of the following receptors? Does not. Dopamine, which is given in acute CHF, does not act on which of the following receptors? Option number 1 is the receptors on the renal blood vessels. Option number 2 is dopamine 1 receptor. Option number 3 is beta 1 receptor. Option number 4 is alpha 1 receptor. कौन से receptor पे dopamine does not act when it is given in acute congestive heart failure? It's ऐसे questions में please make sure you read the question very carefully because the examiner is trying to give you the hint. ठीक है, कि डोपामीन जब हम CHF में यूज करते हैं तब वो कौन से रिसेप्टर पे एक्ट नहीं कर रहा है. So नीरज very good, he says 4, that is your alpha 1 receptor. Okay, any other opinion? किसी और का कुछ और? Anybody differs from this option? किसी का और डिफरेंट ओपिनियन हो? So you know that effect of dopamine जो होते हैं, though they have effect on all these receptors, dopamine, beta 1, alpha 1, but they are dose dependent effects. ठीक है, कम dose में, ज़्यादा dose में the effects would vary from receptor to receptor. So when you give it in CHF, about 2 to 5, then it does not affect the alpha receptors. It affects the dopamine receptors. It affects your beta 1 receptors. That is what we want in CHF. Okay? So we want an inotropic action. But it does not affect alpha receptor, because agar alpha receptor, agar high dose donge, then it will act on the alpha 1 receptors, leading to vasoconstriction, and that will not solve the purpose. It will further deteriorate the CHF. So here, when you're giving it in acute CHF as an inotropic agent, then the effects are usually seen on the renal blood vessels. It is enhanced that. Secondly, on the beta 1 receptors, where it will show the inotropic effect. So, वहाँ पे alpha 1 नहीं आएगा. Otherwise, अगर बात करेंगे, question आता है, on what receptors does dopamine act? Then definitely it acts on the alpha 1. But because यहाँ पे उसने specifically बोला है कि CHF में यूज कर रहे हैं, so CHF में हम ऐसी डोज नहीं देते कि वो अल्फा पे एक्ट करे. So that is what you should always make a point, that always understand the question, the situation which is asked, because this is where the examiner is giving you the hint what to mark. All right. So that is the correct option to this. The alpha receptors. Okay. Now the next question I have, that a hypertensive patient on metoprolol, treatment was added verapamil. ठीक है, a hypertensive patient on metoprolol treatment was added verapamil. So which of the following effects can be seen in this patient? Which of the following effect can be seen in this patient? Number 1, atrial fibrillation. Number 2, bradycardia with AV block. Number 3, torsades de pointis. Number 4, tachycardia. ठीक है? So patient was on metoprolol therapy and verapamil was added to the patient. So what all can be seen? Neeraj says bradycardia. I'll repeat the options again for the others, whether it is atrial fibrillation, whether it is bradycardia with AV block, whether it is torsades de pointis, or whether it is tachycardia. Okay, Varshne Siddharth says bradycardia. Yes, bradycardia. Dolly says, excellent. I think you all know that both of them, whether it is a beta blocker or CCB, दोनों का effect होता है, that they for the enhances the AV block as well as the bradycardia. So that's why verapamil should not be combined with the beta blocker. Okay? So this is an important drug interaction also to remember, because they both enhance the bradycardia. No, not fibrillation. They won't cause, they decrease करते हैं, increase नहीं करते. So fibrillation is increase in the atrial heart rate, while they decrease that. So दोनों decrease करते हैं, when you add them together, they will further decrease the effect on the heart. So they will depress the heart further. So इसका correct option is bradycardia with AV block. Alright, another question on beta blocker which is asked is, propranolol can be used in all except. Propranolol can be used in all except. Number 1, atrial flutter. Number 2, variant angina. Number 3, thyrotoxicosis. And number 4, hypertrophic cardiomyopathy. So you have to know the uses of beta blockers as well. So propranolol can be used in all except atrial flutter, variant angina, thyrotoxicosis या hypertrophic cardiomyopathy. किस में नहीं यूज करते? Propranolol is used in all except. So in which of the conditions we do not use propranolol? Variant angina. Very good, Dolly. It is variant angina. Yeah, thyrotoxicosis is number 3, sensitive souls, and we do use propranolol in thyrotoxicosis. Yes, Neeraj, it is variant angina. We don't use beta blockers in variant angina because there is coronary vasospasm. ठीक है? सो कॉरोनरी वेजोस्पैज्म है उस कंडीशन में, तो अगर आप बीटा ब्लॉकर दे रहे हो, इट इज फर्दर गोइंग टू एग्रेवेट दैट कंडीशन. ठीक है, सो वी डू नॉट गिव बीटा ब्लॉकर्स इन वेरिएंट एंजाइना और एंजाइना. ठीक है, I hope so. All the uses of beta blockers are very important to know, because ऐसे क्वेश्चन आज कोई और यूजर आ जाएगा. सो रिमेंबर, और यू शुड नो ऑल दीज, विद हाइपरटेंशन है, असेंशियल ट्रेमर्स है, थायरोटॉक्सिकोसिस है, प्रोफिलैक्सिस ऑफ माइग्रेन है. सो वन टाइम ये भी क्वेश्चन आया था कि प्रोप्रानोलॉल इज यूज्ड इन ऑल एक्सेप्ट देयर वाज द ऑप्शन ऑफ ट्रीटमेंट ऑफ माइग्रेन. So see, usually it is not used for treatment of migraine, it is used for prophylaxis of migraine. So remember कि ये भी आप पढ़ो कि वो ट्रीटमेंट में नहीं, ट्रीटमेंट में ट्रिप्टन्स या अर्गोट एल्कोलॉइड्स वो वाले ड्रग्स, या अगर एक्यूट अटैक है एनएसएड्स वगैरह यूज होते हैं. बीटा ब्लॉकर्स आर नॉट यूज फॉर ट्रीटमेंट, दे आर यूज्ड फॉर प्रोफाइलैक्सिस. सो ये भी आप ध्यान से पढ़ना ऑप्शंस में. कई बार ट्रीटमेंट को टिक नहीं करना होता है, इट इज प्रोफाइलैक्सिस टू बी मोर स्पेसिफिक व्हेन यू टॉक अबाउट माइग्रेन. There's a difference between treatment and prophylaxis. All right. Now these are some, the last bit is, these are some true false questions. Okay? True and false. So you have to tell me, I'll tell you one conditions. These are all the clinical uses of atropine. So you have to tell me whether this is true or not. So there are 5 options given. Every option को हमने true या false mark करना है. So and this is in regard to the uses of atropine. First, atropine is used in the treatment of belladonna poisoning. True or false? Atropine is used in the treatment of belladonna poisoning. True or false? Yes, come on. True or false? Yes? Sahil says true. Atropine is used in the treatment of belladonna poisoning. Dhyan says so, no. False. Yes. Atropine is used in the treatment of belladonna poisoning. पूछ रही हूँ मैं. Yes. False. Atropine तो खुद ही belladonna poisoning में है. So how can you use that in the treatment of belladonna poisoning? Contraindicated. So what is the antidote for belladonna poisoning? Treatment क्या है उसकी? What do we use there? So what is the treatment of belladonna poisoning? अगर question आता है, which drug will you use for the treatment of belladonna poisoning? Yes? No. Trimethoprim? Trimethoprim कहाँ से आ गया? ये तो एंटीबायोटिक है. Trimethoprim is an antibiotic. एंटीमाइक्रोबियल ड्रग है ना, जो कोट्राइमॉक्सिजोल में होती है. Physostigmine, excellent. It is physostigmine. Physostigmine. Why not neostigmine? Physostigmine यूज करते हैं. Why not ACH? No. ACH क्या हुआ? एड्रीनोकॉर्टिकल हार्मोन. एसिटाइलकोलिन हम यूज कर सकते हैं. डू वी यूज, अगर आप एसिटाइलकोलिन इज योर ACH you mean acetylcholine. So do you think we can use acetylcholine therapeutically? Can we use acetylcholine therapeutically? Yes, very good. Neostigmine does not have a central action. It is a quaternary compound, non-lipid soluble, cannot cross into the central nervous system. Excellent, Neeraj. Yes, acetylcholine. Can we use acetylcholine? Can we use acetylcholine? Do we use acetylcholine therapeutically? Please tell me that. इसको डाउट को हम सॉल्व कर लेते हैं अभी. No use. Why? Why is acetylcholine not used therapeutically? रीजन क्या है? ये भी एक इंपॉर्टेंट MCQ है. क्यों नहीं करते? 2 reasons. Yeah, it is extremely short acting. Yes, extremely short acting. Very brief. Milliseconds में it gets metabolized. And number 2, it is non-specific in action. It will act on both muscarinic as well as the nicotinic receptors. So it is of no use to us. So it is not used therapeutically because of these 2 reasons. Extremely short duration of action. Number 2, it is non-specific in its action. So acetylcholine यूज नहीं करते. तभी तो हम acetylcholine esterases यूज करते हैं जो acetylcholine का लेवल बढ़ाएंगे आपकी बॉडी में. ठीक है. सो अदरवाइज हम acetylcholine सीधे दे सकते थे, but we cannot give it straight away. Right. So this was the first statement regarding the use of atropine. Second is, atropine is a drug of choice for producing cycloplegia in children. Atropine is the drug of choice for producing cycloplegia in children. तो जब बच्चों को हम टेस्टिंग करते हैं, रिफ्रैक्टरी टेस्टिंग एंड ऑल, तो वहां पे हमें एट्रोपिन देते हैं हम उन बच्चों को. इज इट ट्रू? इज इट द ड्रग ऑफ चॉइस देयर? ट्रू, यस, एक्सीलेंट, इट इज ट्रू. बच्चों में दे हैव अ द वेरी हाई सीलरी टोन, सो उनको पैरालाइज करने के लिए वी नीड एट्रोपिन. Yes, it is true. Excellent, Umar. Excellent, Neeraj. So, can you tell me in adults, अगर adults में ciliary muscles का spasm, मतलब उसको relax करने के लिए, you have to visualize inside, right? तो ciliary muscles contracted रहेंगे, आप testing नहीं कर सकते. So, you have to relax them. Okay, cycloplegia. Yeah, it is not phagia. Tell me, it reduces the eye pressure. Atropine क्या करता है? Mydriasis. How will it reduce the eye pressure? Atropine is contraindicated in glaucoma. अभी एक ऑप्शन ये थी. We can अभी आएगी ऑप्शन. We cannot use in eye pressure. वो mydriasis cause करके और प्रेशर को बढ़ाएगा. We cannot use them. हाँ, बड़ों में ट्रोपिकामाइड शॉर्ट एक्टिंग है. नहीं तो अगर एट्रोपिन यूज करेंगे, एट्रोपिन का जो ड्यूरेशन ऑफ एक्शन इज अबाउट 7 days 1 week. तो अगर एक बार अडल्ट के आंख में आपने डाल दिया तो वो 7 दिन तक अच्छे से देख नहीं पाएगा, कोई काम नहीं कर पाएगा. सो ठीक है, सो दैट्स व्हाई इट इज यूजलेस इन केस ऑफ एडल्ट्स. बट ट्रोपिकामाइड 4 to 6 hours तक का एक्शन रहता है. सो देन द पेशेंट कैन गो एंड डू हिज वर्क. ठीक है, सो दैट्स व्हाई ट्रोपिकामाइड इज प्रेफर्ड इन एडल्ट्स, नॉट एट्रोपिन. Intraocular pressure, Umar, and intraocular pressure is your glaucoma. High intraocular pressure is glaucoma. ठीक है, so glaucoma में ऐसी drugs, especially अगर angle closure glaucoma है, if you give a drug which is causing mydriasis, because our target in glaucoma is to either decrease the aqueous humor formation or to उसको बाहर निकालना. ठीक है, so if you have to take it out, if you give a mydriatic, it will further block the canal जहां से वो बाहर आता है. So mydriasis is not an option for glaucoma treatment. Meiosis is an option for glaucoma treatment. So atropine तो mydriasis cause करेगा ना, so we cannot use them in as a anti-glaucoma drug, right? Okay. So second option जो थी, it is a drug of choice for producing cycloplegia. It is absolutely correct. The third one, it is a preferred drug in organophosphate poisoning. True, false? Atropine is a preferred drug in organophosphate poisoning. True, false? Organophosphate में अभी हमने किया. It is a preferred drug in organophosphate poisoning. True. Okay. Yes. Siddharth. Varshini Siddharth says true. Dolly says true. Yes, sensitive soul says true. Excellent. Yes, Alina, true. So it is the drug of choice in organophosphate poisoning. सबसे पहले हम atropine देंगे. And why is atropine helpful in organophosphate poisoning? Can you tell me? Why is atropine helpful in organophosphate poisoning? Yes, why is it helpful? What symptoms does atropine relieve in organophosphate poisoning में? कौन से symptoms को tackle करता है atropine? Atropine is a muscarinic antagonist, right? So it will take care of the muscarinic effects of organophosphates. So that is the most important. Yes, all the muscarinic side effects. Actually, tachycardia is not a feature of, it blocks the muscarinic receptors. Yes. So tachycardia is a feature of anti-muscarinic effect. Muscarinic effect और cholinergic effect होता है bradycardia. ठीक है? So that is, so और जितने भी signs and symptoms, जो भी आप cholinergic के जितने भी आपको इफेक्ट्स याद आए ना मस्करिनिक वाले, वो सारे enhanced हो जाते हैं when you give organophosphate compounds. Because what it does is it blocks the enzyme that is acetylcholinesterase. तो अगर acetylcholinesterase is blocked, acetylcholine will not get metabolized. When acetylcholine does not get metabolized, its levels in the body is going to be high. So whatever action it was doing, it is going to do that twice or thrice its effects. So जो भी चीज, whenever anything gets high more than required, it always gives what it does, it results in a adverse effect. So everything is going to be high. And because estradiol is acting on the muscarinic receptors as well as the nicotinic receptors, but muscarinic effects are the ones that are creating more of havoc. ठीक है? So आप ऐसी ड्रग सबसे पहले दोगे which is blocking the muscarinic receptor. That is the first thing, and that is your atropine IV 2 milligram, and you keep on giving it till the effects get reversed, और हम कहते हैं when the atropinization starts occurring. Now can you tell me one or two signs of how will you know कि atropine का effect आना शुरू हो गया? That you can, आप देख के बता सकते हो कि हाँ atropine का effect आना शुरू हो गया, or signs of atropinization have started occurring. Can you tell me one or two? जो simple आप देख सकते हो बाहर से. Patient को assess जब आप कर रहे हो, you can see now atropinization started occurring. What all will you see? Patient आया है, organophosphate poisoning का atropine दे दिया गया, and you're going on repeating. Very good. First is dryness of mouth. So उसका mouth dry हो जाएगा. Yes, excellent. Second is pupils will start dilating. Yes, sweating. Okay. So it is going to go low. Normal rather, yeah. The heart rate starts going higher. These three are the main important points जो आप बाहर से आप monitor कर सकते हो. You check his mouth and all secretions are going dry. Especially pupil is getting dilated. Very important point, because organophosphate has pinpoint pupil. So pupil starts getting dilated. And number third is that the heart rate, it starts increasing. ठीक है, tachycardia या heart rate बढ़ना शुरू होता है. Relax आपको पता नहीं लगेगा बेटा. Patient, how will you feel the patient is getting relaxed? You have to monitor the vitals, or you have to see for yourself. जब आप patient को देख रहे हो, what are the signs that you know that? Because अगर आप ज्यादा atropine में दोगे, उसके side effects भी आना शुरू हो जाएंगे. So there has to be a level कि आप देख रहे हो कि हाँ आप patient normal है, तो this much is the atropine I need to give now, and then you can go for the oxymes, right? Okay. Now the fourth statement here. Atropine is used in the treatment of bradyarrhythmias. True, false? Atropine is used in the treatment of bradyarrhythmias. True, false? Yes? False. Okay. Dolly says true. Okay. See, अभी हमने बात किया ना. Bradyarrhythmias means decrease in the heart rate. So yes, we can use them because they are causing increase in the heart rate. ठीक है, ये opposite करेंगे ना, muscarinic effect को opposite करेंगे. So yes, they can be used in the treatment of bradyarrhythmias. ठीक है, that's a true statement. Now the last statement, जो हमने पहले भी अभी I've already discussed, but still, atropine is used as a first line drug in the angle closure glaucoma. First line drug in angle closure or narrow angle glaucoma. Atropine is the first line drug. Is it true or false? We just discussed this point. Atropine is used as a first line drug in angle closure glaucoma. True, false? नहीं, ये यूज करते हैं कि नहीं करते, बिकॉज क्वेश्चन है ट्रू फॉल्स मार्क करना. Atropine is used or not in the treatment of angle closure glaucoma? False. Okay. Dolly says false. False. Maybe no idea. Yes, अभी we discussed no angle closure glaucoma, narrow angle glaucoma क्यों है? Narrow glaucoma is when there is increase in the intraocular pressure. ठीक है, जो आपकी आईज में वो aqueous humor fluid बनता है, ठीक है, एंड वो ड्रेन भी होता है, यूज होता है, देन ड्रेन हो जाता है. बट अगर वो फ्लूइड ड्रेन ही ना हो और आईज में ही रहे, तो वो बनता रहेगा एंड इट्स गोइंग टू प्रेस ऑन योर आईज एंड पीछे नर्व्स पे प्रेस करेगा. इट कैन बी रियली डेंजरस. सो इफ यू वांट टू डिक्रीज दैट प्रेशर, यू हैव टू so that what happens is या तो वो बाहर निकल जाए फ्लूइड या उसकी प्रोडक्शन कम हो जाए. सो नैरो एंगल ग्लोकोमा इज अ कंडीशन जहां पे जो चेम्बर है आपका, जो इंटीरियर चेम्बर पे उन पेशेंट्स का ऑलरेडी बहुत नैरो होता है, और अगर नैरो होएगा तो उनका जो एंगल है वो भी नैरो है. सो एनी ड्रग विच इंक्रीजेज द प्यूपिलरी साइज विल फर्दर कॉज obstruction in the drainage of the aqueous humor. So we can never give adrenergic drugs like these mydriatic drugs basically, which increases the size of the pupil. तो इसलिए ये contraindicated होती हैं. Any mydriatic drug is contraindicated in narrow angle glaucoma. So atropine also causes mydriasis, and therefore it is contraindicated in narrow angle glaucoma. We can never give anything. We have to prefer to give miotics, or we can give drugs which enhance the removal or drainage. So out of these questions, if I am telling you the topics which you need to be very, very thorough with are your anti-glaucoma drugs, treatment of organophosphate poisoning, antidotes जितने भी आते हैं ANS में, आगे भी जो ANS में antidotes हैं, you should know them in and out. Which is the antidote for what? जो हमने किया poisoning with belladonna, atropine, ठीक है. poisoning में कौन सा antidote use करते हैं, nicotine में कौन सा use करते हैं, then what else was there? I think these were 2 or 3. and nicotine में हमने किया, उसमें किया muscarinic antagonist, we did atropine, ठीक है. so these antidotes are very, very important for you to know. आगे भी आते हैं chapters में antidotes, पर जितने भी antidotes हैं, start making a list of the drugs and their antidotes, and they will be asked, at least 1 or 2 are asked in every paper. So these days it is like बहुत ज़्यादा common है. so antidotes तो आपके tips पे होने चाहिए जितने भी drugs आते हैं, ठीक है. So these were the few questions, because there are so many other questions. I could take only these few. And so the topic, again I'm saying, just go and revise these topics and start solving MCQs on these, and you'll be more well versed with all this, right? So with this I conclude the session today. So next time I'll be meeting with more questions which have been asked, because ANS is a vast topic, so there are more important topics. Again, I'll be asking you more questions and we'll be discussing more important topics. And if you have any suggestion, yeah, ganglionic, I said nicotine can be used. उसमें ganglionic blocker use कर सकते हैं nicotine के लिए, I remember. और हमने ओपी पॉइजनिंग के लिए यूज किया, सो उसके लिए वो यूज कर लिया, ठीक है. सो और एट्रोपिन, 3 मेजर हमने किया, एट्रोपिन पॉइजनिंग के लिए, ओपी पॉइजनिंग के लिए और निकोटीन वाले के लिए, ठीक है. सो ये सारी चीजें प्लीज मेक श्योर दैट यू नो फॉर योर फ्यूचर, इफ यू आर अपियरिंग इन योर एग्जाम्स फ्यूचर में. ये वाली अगर आपने एंटीडोट्स इज अ मस्ट नो टॉपिक, एंड एंटी ग्लोकोमा ड्रग्स अगेन अ मस्ट नो टॉपिक. the adverse effects, the actions, ठीक है. so all these, and anti-glaucoma drugs पे I have a video on YouTube. If you get a chance to watch, I've explained in details about these anti-glaucoma drugs, how they act, कौन सी drug drainage improve करती हैं, कौन सी drug production को decrease करती हैं, all these things, very, very important. All right, so you can just go and take a look there. And yes, and in the future I might be coming up with more live sessions, because exams, a lot of competitive exams are coming up. So on YouTube with Unacademy, most probably I'll be coming up with free live sessions, and वो उसका the notification will be told to you on Insta also, so you can join those live sessions, because YouTube में the advantage is I'll be able to show you the screen also, and we'll be able to, it will be more, because Insta में it's not possible to show the screen. So to make things more clear, we are going to do the screen में draw the diagram and show you all those things. वो सारी चीजें that will be more clear to you on YouTube live. So whenever they happen, as the sessions happen, which are going to be, I think, more frequent in the coming weeks and in the month, so do keep a track. So because if you've already subscribed, definitely you'll come to know, and I'll definitely tell you when those sessions are happening. If I know in advance, I will post a list of the days and dates and timings of that also. So I'm sure that will be very, very useful to you. All right. So on that note, take care. Have a great evening and a great weekend. See you next time. Bye-bye.